afternoon. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. Welcome to our webinar on the loneliness epidemic among the COVID-19 pandemic, presented in collaboration with Friends Health Connection. Social distancing has prevented the spread of COVID-19, but has left many feeling lonely and isolated. During today's webinar, we will learn more about how isolation affects mental health and healthy coping strategies. Kelly Scott, an advanced practice nurse with Robert Wood Johnson University Hospital Somerset's Behavioral Health Department, and Kathleen Haughey-Eannone, Director of Robert Wood Johnson University Hospital Somerset's Eating Disorder Program, will also discuss the signs and symptoms of anxiety, depression, eating disorders, and alcoholism, including diagnosis and treatment options. We will begin our webinar with about 20 minutes of a moderated discussion, and then we will open it up to questions and answers from our audience. So welcome both of you, welcome audience. So Kelly and Kathleen, let's begin by having you tell us a little bit about yourselves. So why don't we start with Kelly, if you would begin just sharing the audience a little bit about yourself.
Okay, so I'm a psychiatric APN here at Robert Wood. I work in our partial hospitalization mental health program and intensive outpatient program. And then I also see patients on medical floors treating mental health issues.
Wonderful, welcome.
Thank you.
Kathleen, how about a little bit about yourself, please?
Sure. I've been a nurse for 22 years. Currently, I am the director of the Eating Disorders Programming at Robert Wood. So that's an inpatient unit as well as partial hospital and IOP.
Wonderful. Well, welcome both, and we appreciate you taking time out of your busy schedules to share and speak about this important subject, because it's been really very tough for many individuals amid COVID in quarantine to feel connected and have been very lonely. So Kathleen, I'm going to direct this question to you. As you know, the COVID pandemic brought mandatory stay-in-place stay-in-place orders and social distancing guidelines to prevent the spread of the virus. What impact have you seen that has this had on mental health?
So I think the word to describe it would be anxiety. The increase in anxiety about getting sick, family members getting sick, concerns, fears, and anxiety over finances, ability to find childcare. It's heightened the general population's anxiety. So when you look for patients who have complaints of anxiety and then patients who already had anxiety previously, it's not only heightening anxiety of people who don't have mental illness, but the anxieties that are already there for people who do.
Okay, yeah, thank you. I know we've, in the community, we've been hearing, such things as well. So when we talk about isolation, what is isolation and what causes it?
Well, right now
what does it cause, rather? Sorry.
Yeah. So right now we're in an imposed isolation. We were told that we had to stay home. So, in mental health, when we define what isolation looks like, when we're talking just in general about, people that we're treating, patients on the unit, isolation is when patients themselves restrict visitation from family. They create their own self-imposed isolation where they go into themselves and they start to shut down. Being forced into isolation, I think the general population is starting to feel some of what someone who is suffering with illnesses such as depression, anxiety disorders, substance use disorders, even PTSD, all topics we're going to talk about today. Isolation increases the risk for them in general. So I think we're going to see a larger population of patients complaining of these disorders moving forward. And for the patients who are already suffering with anxiety, depression, PTSD, we're going to see a worsening of those symptoms.
Wow. Thank you for that explanation. So Kelly, let's look at some of those mental health issues that you've both been seeing recently. So first, let's talk about anxiety, because I know Kathleen just brought that up. What are the signs and symptoms of an anxiety disorder, and then how can that be treated?
I have to say anxiety has been one of the most common effects from COVID that I've seen. Just in general, just a little information about anxiety disorders. They are more common in women. They can come and go in a person's lifetime. They do have symptoms similar to behavioral and physical issues. Some, people who are suffering from anxiety disorders, they'll describe feeling restless, wound up, being easily fatigued, irritable, difficulty controlling feelings of worry, sleep problems. That's a huge issue right now. People having difficulty falling asleep, staying asleep. Anxiety can cause physical symptoms: fatigue, nausea, diarrhea, pain, weakness, dizziness. It's even been implicated in several chronic physical illnesses such as heart disease, chronic respiratory disorders, gastrointestinal conditions. In terms of, treating anxiety, I really encourage people, kind of reducing the stigma, recognizing that this is, something that anybody can really struggle with. It doesn't discriminate. Talking with your primary care physician, reaching out, for assistance.
That's good. Well, yes, thank you. Very good point. Very good point. So depression is another common mental issue, right? Often, sometimes anxiety leads to depression. Can you explain what are the signs of depression and how people can get help if they are feeling depressed?
Sure. Something I'm really seeing now is people recovering from COVID are struggling with depression. I've also seen people who have been caring for someone with COVID experiencing depression. People are trying to get back into their routines and lives, and people are having trouble adjusting. Keep in mind, depression can happen at any age. 80% of adults with depression report some difficulty with work, home, school activities. Symptoms of depression: constant sadness, anxious, you feel hopeless, helpless, you might feel like a burden to others. You can't enjoy the things that you used to enjoy. Some people will overeat, some people have poor appetite, some people want to sleep all day, some people cannot sleep at all. Decreased energy, you might notice yourself or other people may notice that you're moving very slowly. Those are some of the symptoms. And again, treatment, combination of things. There are a lot of good medicines that can be helpful. Psychotherapy as well, support groups. There's a lot of tools out there that people can take advantage of.
Great. Thank you. So switching gears, Kathleen, let's go back to you. So others have been coping with stress of quarantine through food and alcohol. For those who turn to food, some may undereat and some may overeat. Gives a new meaning to the COVID-19, right? So what are the signs that we can recognize if you have a problem, and how should they seek help as well?
So with the eating disorders, specifically, as Kelly mentioned, with depression and anxiety, you can have overeating or undereating. Eating disorders truly do stem from wanting control within your life. So if you have anxiety, if you have depression, the eating disorder becomes a way to try to minimize some of the symptoms of it. So anorexia, which most people are probably familiar with, is where you are restricting calories. It becomes a cycle. The calories are restricted. It causes chemical imbalances in the body. You're already suffering from an underlying mental health illness such as depression or anxiety untreated, and it just goes round and round. It's a cyclic thing. So if you see yourself or a family member starting to restrict meals, or they're starting to count calories obsessively, particularly with the food insecurities that we've seen around COVID, people worrying about where they're going to have their next meal. So maybe it started as just restricting because you're trying to extend the food that you have in the house, but now it's become a pattern. That would be something that might warrant an eval with us, to come in and talk to us and just see if there's something we can do. Bulimia nervosa is where there's a binge of food, and then there's a purge of some sort, whether it's use of laxatives or induced vomiting. And then last disorder that we do treat in eating disorders is binge eating disorder, where patients sit down and do consume large quantities of calories all in one sitting. And if you were to talk to somebody that was doing that, they often describe that they had the urge to binge to reduce anxiety, to normalize their depression. They use food as their medicine at that point to try to self-medicate themselves.
Oh, thank you. So on the flip side, with loneliness and the stress of COVID, others have turned to, alcohol and substances to cope. So what are the signs of alcohol overuse? And then what are some of the common substances that people have been using as well?
Yeah, so with alcohol, the definition of a substance use disorder, and just in general, is when you are using enough of the substance, whether it's alcohol or a drug, that it's starting to interfere with your activities of daily living. Issues going to work, going to school, being able to get up and do the things you need to do. Well, we've been in this state of we're at home, so those things aren't in the picture anymore. I think the fear from mental health providers is that as things start to open up and people have to renormalize, that there are going to be people who realize that maybe they've overdone it with alcohol, or they've started using substances. And the key to it is, if you try to start to reduce your consumption of alcohol, specifically right now we're talking about, like you've been drinking a lot, and you start to reduce your consumption. If you get tremors, if you have sensitivities to light and sound, if you start to feel like you have a temperature, or maybe even are running a temperature, there's a chance that you could have been consuming enough of the alcohol over a long enough period of time that you have become addicted. And the concern with the alcohol addiction is that if you stop alcohol, if you were to stop the consumption at that level, it actually can be life-threatening and dangerous. So if you notice that you're starting, as you're getting back into your normal life, if you start to reduce the consumption and you start to feel like you're like you have tremors in your body, in your hands, in your face, you feel flushed, you do need to seek medical treatment for that, because it can be serious. The opiates that are currently used most frequently right now is heroin in the state, heroin mixed with fentanyl. Although not a deadly detox, it can put quite a stress on the body, and you can become quite ill when you stop using those substances. People describe the detox from opiates like a bad case of the flu. You get body sweats, shakes, goosebumps, vomiting. And again, there's treatment out there for that as well. There's all kinds of treatment for that out there as well, actually. There's inpatient detox for both. There's 12-step groups, and there's different outpatient sites do offer treatment. The one thing that I would caution the people listening on is that if you think you have an addiction, it's worthwhile to get the assessment to see if there's some medical interventions that could help.
Well, thank you. Thank you so much. So I know, like, throughout this, people are alone, and many of them have faced some traumatic situations during COVID-19. Again, all alone. So Kelly, if you could please, I guess explain somebody who suffers from PTSD. Could somebody suffer from that during COVID? Uh-oh, we're losing you again. Oh, wait, there it is. So if you could somebody suffer from PTSD? And then what is it, and what are the symptoms? We'll start there. I'll break these questions down a little bit.
Absolutely. So anyone who's experienced a scary, shocking, dangerous event can experience post-traumatic stress syndrome. Symptoms can begin early in the first 3 months. It can pop up years later. And it can be, sometimes it may not even be something you've directly experienced. Maybe a friend of yours had this traumatic experience that, you've heard about. Some of the symptoms are having nightmares, having flashbacks, maybe you're avoiding a certain place due to, that triggers memories. You're avoiding thoughts or feelings related to the traumatic event. Who's at risk for it? Like I said, anybody is really at risk for it, but somebody who's had COVID, first responders, medical providers, police, family members of first responders, war veterans, a person who's been through a physical, sexual assault, abuse, accident, disaster.
So how do you treat PTSD?
So, treating it is really similar to all the, the other depression and anxiety. PTSD really comes under the anxiety kind of umbrella. We use medicines, we use antidepressants, as well as with psychotherapy, individual and group.
Okay, well, thank you so much. So kind of looking at how we can make things better. So Kathleen, what are some healthy ways people can cope with feelings of isolation or, that they may be experiencing?
Yeah, so, I guess if I had a message to give to the community, the first piece of it is, if you or somebody in your home or in your family is suffering, if any of these things we've talked about touch you, reaching out to find out whether or not there's services that can assist you in the, at the hospital here or within the community, but providing that non-judgmental support for families or friends, or even yourself, taking out, as Kelly said earlier, the stigma around mental illness so that you can feel better. Is number one. Things that you can do at home, just finding ways to reduce anxiety, stress, depression, going out and taking a walk, keeping your social distance, but taking a walk, going to the beaches are open, the parks are open, going out and getting some fresh air, finding some healthy coping skills that work for you, whether it's journaling, taking, doing some art classes. I know they have some online where you can get on and paint, music. Just sometimes listening to music is enough to get someone to the point where they can calm down. Finding what works for you. No one thing is going to work for one person. It's really what you enjoy that brings you a little bit of comfort and a little bit of relief from the symptoms that you're feeling. And then last but not least, if you are struggling, reaching out to family and friends and making those meaningful connections, because we've been so far apart from each other. Even the Zoom call is a meaningful connection right now. And that's good. It's good that everybody's on and that Kelly and I can talk to you guys. Just being, non-judgmental and supportive with each other is probably my best message of the day. Yeah.
No, that's great. Thank you. Now I was actually going to ask you what activities that people could engage in to really address that loneliness, because we are social beings and we need to feel connected so we don't have those feelings of loneliness, correct?
Yes, absolutely. So, one of the things that we have here in all of our programs is they're called adjunct therapists. So they do music therapy, art therapy, recreational therapy, dance therapy. There's all kinds of, there's science to doing things that you enjoy to make you feel better, so find out what works for you. And part of it is getting up and just doing it. It's very easy to get into the routine of, particularly with being in isolation, with getting up and sitting on the couch and watching TV, or getting up and just sitting. Part of working on, personally working on depression, anxiety, is breaking through some of the things that you've done that help to perpetuate the cycle, right? So getting out of your comfort zone a little bit and finding things that work for you is important.
Great. Well, thank you. Now, I know it's really important if somebody's feeling lonely, right, that, that they do some of these activities. But again, both of you have mentioned a number of services that we provide. So Kelly, if you can kind of give everybody an overview of the behavioral health services available at Robert Wood Johnson University Hospital, Somerset, if they're feeling like, based upon all the suggestions that were made in terms of activities, they need further maybe intervention, what they could take advantage of. Oh no, Kelly, you're quiet again.
Okay, we have we have a mental health intensive outpatient program and a partial hospitalization program, which consists of group therapy, individual psychotherapy, and medication management. And then we have a voluntary inpatient psychiatric unit. We're working right now on an involuntary psychiatric unit that hopefully will get up and running in the next couple of months. We do have a crisis center in our emergency room for people who are in crisis. So we do have a lot of services for people to really, seek help for.
That's great. So we definitely want to encourage folks to reach out. Now, Kathleen, do you have, maybe you could share, or either one of you could share those numbers?
Yeah, I have them.
Okay. Do you want to provide them to the audience?
Yeah, I'll give everybody like a 30-second pause to grab a piece of paper and a pen if they don't have them, and then I will give you the numbers.
Okay, and we can also, as you're giving them, I will put it in the chat feature. How's that?
Okay, good. All right, so the main number to call to find out whether or not we have services that can assist you with whatever is going on is our access number. Our appointments for partial and IOP and eating disorders inpatients would all go through the access number. So that number is 1-800-300-0628. And they're open 24 hours a day, 7 days a week, 365 days a year. So that would be partial hospital for eating disorders, and also for the general psychiatric units, and IOP, which is intensive outpatient. So it's a little shorter program. And then the number for, obviously, if you're in crisis, any sort of suicidal thoughts, if you've gotten to that point, or if you feel that you are in a position where you are, your depression or anxiety is interfering with even your ability, to make the calls, then obviously you pick up the phone and call 911 if you're in crisis. I was asked to give out the number for the AVP of the Behavioral Health Services in case you have questions or you have concerns, you're not able to get through to the 1-800 number. Her number is 908. Her name is Chris Bellardo. Her number is 908-704-2739. And then we should put up the main number to Somerset. I know you can type that in if you guys have questions or concerns and you want to call the hospital directly.
Oops. Sorry, here we go. That's 908-685-2200. Is that the one you want to?
Yeah, we'll put that up.
Okay.
If you feel like you're in crisis, but you don't want to call 911, you can always call this number to be transferred to the crisis unit in the ED. And I'm going to give you my number as well. If you have eating disorder questions, you can call and leave me a message. I will get back to you as soon as I possibly can. My number is 908-203-5970. And really, we wanted to provide the numbers because we want to break down the barriers to care for people. We want people to reach out to us. We want to be able to help the community, heal and get better.
Yeah, especially times like now where it's really tough, where so many people are alone in this, pandemic, and, things are starting to open up. So hopefully that will help. So thank you both. So I want to give some time for our audience to ask some questions and open it up to them. If anyone in our audience does have any questions, please post them in the chat feature. And I'm going to give you a minute. I know we already have some questions posted. I'm going to go to the top and start with the first one. So this is in regards to PTSD. So the question is, how do you cope with images from today's news in ways that don't cause PTSD? So who would like to field that one? Is that Kelly? Maybe?
I'll go ahead and take that.
Okay.
So, I think it's important to decide how much exposure you are going to take to the media for right now, limiting yourself with that. And then once you have shut it off, distracting yourself, find like the coping skills Kathleen just talked about, what coping skill can I use? And then, if you're really, really struggling, reaching out to a family or friend, and not, everybody else is also going through the same thing.
Thank you. Yeah, it's been tough. I love your suggestion, because watching the news is very tough. It can be depressing at times just to watch it. I mean, I know it's important to feel connected to what's going on in the world, but I think you have a great suggestion of putting some limits on things. So the next question from our audience is, what if our spouse or family members are not supportive of reaching out for help, or who don't understand our need to reach out to help? Can you talk about it confidentially? And again, does behavioral health cover insurance? So, well, how about we give that one to Kathleen? Is that good?
Yeah, I'll start with the insurance piece. All insurance plans have a form of behavioral health care connected to it. They have, it's parity and equity in behavioral health. To what degree it's covered depends on the different insurances. So that could be a question that could be answered depending on what you're looking for, either through our Access Center, they do insurance verifications, or if you were truly in crisis and you came into the ED, that's an emergency visit. And at that point, a discussion could be had about what options you have as well once somebody reviews the insurance. With regard to family and friends who aren't supported, this goes back to the conversation about stigma. And it's a hard conversation to have, particularly when you don't have the support at home. I guess I would implore whoever asked that question to reach out and talk to the people here to see what, A, what's going on with you, and B, what we can do to help support you. And if we can at least figure out where we can give you some support, then we can work on helping you have a discussion on how to pull family in and get them more supportive of you as well, which may include family sessions, family therapy, working with the family to try to understand, where you're at with your mental illness. Mental illness, I always use this little comparison. Mental illness is an illness. This is part of breaking the stigma. It is an illness. So when we have patients come in for mental health treatment and they're embarrassed or upset that they have to do it, I always ask them, would a diabetic be embarrassed if they had to come to the ED for treatment? Or would a diabetic be embarrassed to have to go to their endocrinologist for a checkup? No, it's an illness, just like diabetes is. So why would there be the difference in how we look at it? So that's part of stigma and breaking down just barriers in general. And everybody on this Zoom call has a responsibility to do that for themselves, to break down that stigma. And if you really do need help, start reaching out to get the help that you need.
Now, just to be clear, if you could clarify, when somebody comes and they talk to you or your team members, that talk is confidential, correct?
100% confidential. We only share with family and with other people that they've identified that they want us to have a conversation with, only at the direction of the patients.
Okay. So thank you so much. Our next question, I think this one, may have come up because Kelly, I think you had mentioned this individual, as parents or caregivers, we often leave our own care last. What would you say to somebody who feels they need help, but don't feel they are in a position to step away and get the help that they need?
I think that we all kind of have heard that you need to take care of yourself before you can take care of somebody else, right? Easier said than done. Right now there's so many different ways to access health, to access treatment for mental health. It's not like it used to be. Doing a lot of doctors right now are doing telehealth, which means you don't even have to leave your home. But again, you'll be such a more effective caregiver if you are, receiving help for yourself.
Yeah, absolutely. Thank you. So our next question is, what advice do you have to parents who are trying to prevent their child or children from becoming depressed or, anxiety ridden due to today's, I guess, limitations and really, the environment in which we live? Who would like to take that one?
Well, I mean, I'll say, I think it's important to have those discussions with your children and teenagers about, how are you really, feeling? And then also just recognizing the symptoms. Are you noticing that my child is, eating a lot more and not eating for the right reasons? Okay, maybe I'll have a discussion about, what's really going on, and just letting them know that this is a safe place to really talk about these things too.
Yeah, that's a great point. So because of COVID and people having to be quarantined and social distance, a lot of the providers have not been meeting with individuals in person. So our next question from our audience member is, can you get telehealth or telemedicine for mental health services? And does insurance cover it? So Kathleen, you want to take that one?
Yeah, so yes, we actually are doing telehealth right now for our partial and IOP patients, although we've started to bring back the patients into the community, into the hospital community again. I think the plan is to continue the telehealth for at least, the time being, because there's a concern obviously about another resurgence in the fall of COVID. And I think maybe it'll be something that we might consider doing even ongoing after that in one form or another. Most of the programs in the state are offering forms of telehealth, with different treatment focuses. And yes, insurance is paying for it. Insurances are being very cooperative with telehealth right now because of what is going on. So there's a lot more options for us right now, and we're able to get coverage a little bit easier.
Yeah. Oh, good. So I know a lot of people are missing that human touch, even the ability to like hug somebody, and especially, our older adults, it's been a true challenge. So this audience member posed, how do you help parents and seniors not to feel isolated? Who would like to field that one?
Yeah, I would encourage them, to reach out to family and friends by phone, by the resources that we do have, to kind of really keep those connections. And if you have seniors that maybe aren't familiar, with technology, calling them up, saying, hey, let me guide you on how you can do this.
Yeah, so great. And and talking to different community members too, it's like I know over the holidays, some people may have gotten together but stayed socially distanced as maybe an option as well. And wearing masks, because I know we in community health will always say, please wear masks, still be socially, still socially distance from each other, wash hands, disinfect and all that. But that may also too help with some of that connection. So another question, with kind of the reopening of RWJ Somerset, we're seeing slowly some of the services that we once offered come back. At this time, does RWJ Somerset offer group therapy as an option for folks?
Yeah, so we brought back the patients this week for Partial Hospital, which is a program it's a 5-day-a-week program. It's from 9:30 to 3:30, and they have group therapy within the Partial Hospital program. They have group therapy with LCSWs, so social workers, and then there's also group therapy with the adjunct therapists. So adjunct therapists are art, music, dance, recreation therapists who have their master's degrees, and they have a master's in counseling of some sort. So there is group therapy built into the outpatient programs.
Oh, great. That's good to know. And I think giving, the more we can provide to the community and provide options, I think that will be certainly helpful for folks. So we have another question. So also, can you talk about what happens if you go into an inpatient treatment center at the hospital, what to expect and how long typical treatment lasts?
I think I'll answer maybe for the eating disorders. I don't know, Kelly, if you want to field the other side. So eating disorders specifically. So right now we have a 14-bed inpatient unit that has adolescents as well as adults, 14 and up on the adolescent side. We have registered dietitians which do meal planning, and they run groups with the patients. We have the adjunct therapists, we have therapists that run groups, and there's individual therapy on the inpatient side with the therapists. There's medication management with the nurses, and we have bachelor's prepared MHA. They have a bachelor's in psychology that also run groups and help to supervise the environment on the unit.
Wonderful. Kelly, would you care to share
Yes.
the other side?
Similar with the mental health unit, we have only an adult unit. It's ages 18 and up. It is a 14-bed unit. Patients receive individual therapy as well as group therapy. They're seen by the psychiatrist daily. There's nurses. It is a really great program. I worked up there for years as well. It's a very clean environment too. I want to say that, housekeeping has really been doing a great job here, and the staff with maintaining, a safe environment. And I always tell people it's not a long-term program. It is a short hospitalization, and letting people know that the whole purpose of it really is, for you to return back to the community and be safe. And, you're not going to be there for weeks and weeks and weeks. It's just going to be a short, period of time.
Great. No, thank you. So again, for people, I know there's still some uncertainty, even though we're coming out of COVID, and, going into the fall when we're getting back into flu season. So to kind of help ease on some of those uncertainty and anxiety, what role do you feel like, prevention like exercise may play in it, going for walks? What would you recommend, like going into summer months that, people do to enhance, to decrease those anxieties and to kind of feel connected and reduce loneliness? Is that a loaded question?
No, it's a big one. No, it's a good one though. I think getting out for fresh air I think everybody should be doing it every day. There's no question that just getting a little bit of sunlight, helps to reduce a little bit of that feeling of isolation, being, by yourself in your home, taking a walk, just making sure that we're social distancing as we do these outside activities, right? We want to still protect ourselves, wear masks, and make sure we distance in the park. But I do think getting out and getting some fresh air and getting back to the normal of life is important.
Very good. Kelly, did you want to add anything? Okay. Wait, redo. Yeah.
Okay. I think it's really important to keep up a routine. If you are working from home, still trying to get up at the same time, shower, get dressed, keeping a routine, regular sleep habits, that's really important too. Just to kind of feel a little bit more normal, so to speak.
Yeah. And do you recommend, like in the, while we're masking and stuff, again, through being connected, would you say continue virtual or in person or a combination of both? What's going to make people feel more connected to reduce that loneliness?
I think it depends really on the person. We have to consider their overall health. Do they have, risk factors, chronic health conditions that are big risk factors for COVID? Who are they caring for at home? So I think it's really based on the person and what their needs are.
Okay, thank you. So there's another question from our audience member. This goes back to stigmas, and I know you touched upon it a little bit, but again, how would you address stigmas about reaching out for help? Because I know, again, that's a big fear of people, of not reaching out to help because of those stigmas. So go ahead.
Yeah, I would just encourage people, letting them know mental illness does not discriminate. It can be any socioeconomic background, any level of education. Remembering that, your information that you disclose is confidential. The patient has to give consent for it to be disclosed. Your employer's not going to find out about it. Your neighbors aren't going to find out about it. So those are.
Oh, great. Okay. Well, thank you. Kathleen, did you want to add anything to that?
Well, I mean, stigma is probably my biggest battle right now in my career. I'm passionate about breaking stigma. There's a statistic out there, which when I present, I usually give, that it takes the average person between 8 to 10 years to seek treatment for mental illness because of stigma. And that's just unacceptable. We wouldn't wait 8 to 10 years to treat heart disease or diabetes. So why are we waiting 8 to 10 years to take care of, somebody's mental health? And really suffering with a mental illness, with anxiety or depression, it's painful. It's painful to the person feeling it. And I like to tell people, like, really realistically, the only mental health is a continuum, and maybe somebody at home right now who's been in isolation is feeling an increase in that anxiety. That could be me. It could be you, Serena. It could be Kelly 2 weeks from now. We're all susceptible to, suffering from a mental illness, just as we are susceptible to suffering from other health conditions.
Okay, thank you. So, comment and question from an audience member. So when we are living alone, there is a bigger sense of isolation. When we are living with others, there are stressors from interpersonal relationships. So what would you say to people who are living alone versus those living with others? Are there different ways for our situations on how we would cope?
That's a good question. Well, I think coping skills are going to be individual to the person who's utilizing them, right? I can tell you that I find relief in, drawing. I like music. I'm very artsy. So those are what I use for my coping skills. And I don't live alone. I live with 2 teenagers right now, because one of them is home from college. And I have a third one who's in Philly right now. So my anxiety is through the roof. So I for myself, I like to draw and write. I think the coping skills, regardless if you're living with other people or you're living alone, the key to it is taking time for yourself, finding what works for you, what you get enjoyment out of, what can help you relieve some of the stress or anxiety within your life, and finding that and utilizing it when you start to feel yourself getting sicker.
Yeah.
Like internally.
Great answer. Thank you. So what are your tips for keeping relationships of all kind healthy when we are together day and night, constantly over months? Kind of maybe, and yeah, I think that's an excellent question, because that can bring on, and some studies do show can bring on some domestic violence in some cases. So I think that's an excellent question. Maybe there's not as much loneliness going on there, but excellent question nonetheless. Who would like to?
Yeah, I'll just add, it's important to remind yourself too that this is uncharted territory, right? This is all new to us. Mm-hmm. And so nobody's going to do this perfectly. It's going to be different for everybody. And so, people are spending a lot of time together, reminding yourself this is different than what we used to do. Our lifestyles are different. People are unemployed. People are physically really sick. So being gentle to yourself. There's no right way or wrong way really to do this.
Sounds good. Wonderful. Okay. So, are there any bilingual therapists available? And what if the person is uninsured?
Okay, so I'll take that. In Somerset County here, we do have a community mental health center called Richard Hall Community Mental Health Center. They do have bilingual therapists, and they will definitely work with people who don't have insurance. They will work with you on a sliding scale. Pretty much every county, has a community mental health center really who can help you. Here in our hospital, we do have, language lines that we utilize with computer screens with many, many different languages. So we're able to have group therapy with, someone who speaks Mandarin, Vietnamese, we're able to really accommodate anybody.
And for the question about insurance, just in general, if you're seeking treatment here at the hospital, We do offer financial services to look at whether or not you would approve for charity care, and even maybe sometimes assistance with applying for Medicaid or Medicaid services you might qualify for.
Okay. And charity care is certainly applicable on the inpatient side, and then financial services would look for other types of assistance for our partial program or any outpatient services, correct?
Correct.
Okay, very good. I just wanted to clarify. Wonderful. Thank you all so much. So, hold on. I don't know if we just got another one.
I'll just add, if you are in the crisis center, in the ER, and you don't have insurance, we will definitely, provide you with some resources that you can definitely contact. Don't feel afraid that, I'm not going to get any help because I don't have insurance. There are definitely resources out there.
Wonderful, thank you. So any last comments or remarks that you would like to share with our audience on how they can remain active and feel connected to reduce the loneliness during these times?
Well, I can go first because it looks like Kelly may be struggling with the
mic again.
I think just to sum it up, if we've touched anyone, anything that we've discussed today has touched you, really just taking the opportunity to reach out and see if there's anything we can do to assist you. We really do want to be here for the community. It's been a difficult 4 months, and we want to be here to support the community in any way we can.
Okay. Kelly, did you wish to add anything?
Yeah, I will definitely say, again, that we're here to support you. We are all in this together, right? Everybody is going through this, and it's uncharted territory, right? And really taking it a day at a time. Really important to take care of your physical health as well. Working all together.
Wonderful. So I just want to repeat the numbers that you mentioned earlier, Kathleen. So the main access number for everybody is 1-800-300-0628. Then for Chris Belgiulardo, our AVP of Behavioral Services, her number is 908-704-2739. The main hospital number is 908-685-2200. And for Kathleen Haughey-Eannone, her number is 908-203-5970. I think I got them all correct.
Yeah.
Okay. One last question. So sorry. I guess it says, do you treat substance abuse? I'm going to take that as does RWJUH Somerset or RWJBarnabas Health treat substance abuse? So let's see, Kathleen?
Absolutely, I will.
Go ahead.
Definitely. Okay. So, on our inpatient psychiatric unit, we certainly will assist people with detox and with substance abuse treatment. It's primarily a mental health unit. However, we treat many patients with substance abuse problems. On the medical floors, of course, we have a lot of patients that we treat with substance abuse. Again, with my IOP PHP program, the same we have people with substance abuse, problems. So we definitely offer a lot of support.
And if I could just add to that, like just thinking about where the nature of addiction comes from, it's usually driven with an underlying mental health issue. Patients who do use substances, it's usually to mask symptoms of, to make themselves feel better, the symptoms of depression or anxiety that they're feeling. So, don't think just because, you're out using substances that we couldn't help you, because there's probably other things going on too that, as Kelly said, could be treated within the inpatient unit.
So I think you both have made an excellent point that there are usually comorbidities to maybe sometimes multiple conditions that patients can come into the hospital. So just to clarify for our audience, how do you treat that? Which do you treat first? Do you treat the mental health, the underlying mental health issue, or do you treat the substance abuse issue first?
So I think, like Kathleen said, there are, physical symptoms of withdrawal, both from alcohol and from opioids. So we definitely have to treat those alongside treating, mental health. Of course, at the same time, we do start patients on antidepressants and receiving group therapy, individual therapy. So it's really a combination of both.
Great. Well, thank you. I think that was all the questions our audience had. That was a lot of questions. So thank you.
They were good questions.
Yeah, excellent questions. We appreciate it. So, at this time, I'm going to say this will conclude our webinar for today. And thank you all for joining us.